Hi, and welcome to Cybersecurity in Healthcare, what hospital executives need to know. This is part 2 of a 3-part series. In part 1, we went over some of the terminologies, some of the cyber threats, and we talked about some of the statistics regarding cyber breaches. In this session, we're going to talk a little bit more about the trends that we see, and we're going to talk about the evolving threats. In particular, this session, our objectives will be to discuss the trends in cybersecurity, explain some of the business challenges we face in healthcare, in particular in a cyber world. We'll talk about the risk associated with what we call the Internet of Things, and then finally we'll review some of the top security concerns in healthcare today. My name is Tom Walsh. I'm a certified information systems security professional. I've had my own healthcare information security consulting business now for 13 years. When we talk about the trends in cybersecurity, this slide kind of highlights the main ones that we see most of the attention today where we are dealing with. And the first one is malware or malicious code. And malicious code and malware has been around a long time. We've talked about, or you've seen viruses, and you've heard about worms and other types of threats that are propagated through computers and the internet. But in particular, I want to zero in on a couple of different types of malicious code or malware, and that would be ransomware and then phishing. We also have a lot of mobile apps, and mobile apps can cause us some real issues if we're not careful. Then the other type of attack vector that we look at is the one that's for denial of service attacks, because that can take and shut us down, as I explained a little bit in part 1 with one of my examples. So when we talk about ransomware, we're talking about a malicious code that gets into your computer systems and it encrypts the data at rest. And then your organization's told, you need to pay some type of a ransom if you want the key to decrypt your data. Now in this next slide, what I want to show you here is an example of what the screen might look like. Keep in mind they're all a little different, but this is what you would typically see if ransomware affected one of your computers, or infected, I should say. What you're going to see is, first of all, it tells you your files are encrypted. If you don't believe them, there's a link you can click on there, a button at the bottom that'll actually show you what files they've encrypted. And there's usually a timer. It gives you a deadline to pay the ransom. There's also a button that you click on that will take you to a secure server where you will be instructed how to pay the ransom and then get the key, so that you in turn now can decrypt the data. So this is pretty typical of what you'll see as far as a warning message should you get it. And by the way, down at the bottom, that counter is actually moving all the time. So you know it's counting down the 72 hours. And they're serious about it as well. So what is it that we need to do here is, as far as looking at this? I've talked to the FBI and asked, well, what should you do if you get ransomware? Their advice is, pay the ransom and report it to us, and we'll try to follow the trail of money. The thing is, this is kind of odd when you think about it, but these folks are running a business. So the likelihood of them cheating you is not very high. They want their money, and so if you pay the ransom, they will in fact give you the key. But keep in mind, if they got in there once, they're going to try again. So just because you pay the ransom doesn't mean they're going to go away and never bother you again. It just means they gave you back your key and they made money. So they maintain a level of high integrity in that regard because they're running a business. If the word got out that they weren't releasing the key, people would stop paying the ransom. So it's kind of funny that we would have this kind of a business running. The other things that we have to think about as far as this ransomware is, most folks say, well, we can recover from backup. And that's true if you keep your backups long enough. Sometimes the ransomware, when it gets into your system, the attackers wait for a period of up to 2 and maybe even 3 weeks before presenting you with that ransom notice. And the reason is because the longer they wait, the less likely you are to be able to recover from your backups. So keep that in mind when you're designing your backup systems to make sure you provide enough time. Now, we get a lot of phishing emails, and that's the source where some of this ransomware comes in. It's a goofy looking email perhaps that people click on. Sometimes it's not so goofy though. They've gotten much better. So what are the clues? How do I know if this is a phishing email? So some of the tips are listed here on the slide. They're pretty straightforward. You would look for things like spelling and grammar errors, a suspicious URL. Now sometimes it's hard to find that this is a suspicious URL because they're getting very clever. They're going out and registering domains that are very close to a legitimate healthcare organization's domain. They may be off by one character. For example, if the letter L appeared in a name of the URL, they might replace it with the number 1. In certain fonts, it's really hard to tell the difference between a lowercase letter L and the number 1. I've seen where they've taken a name where it had 2 N's, double N's, and replaced it with the letter M. In certain situations, like if I'm looking at it on my smartphone and the text is condensed and mashed together, I may not be able to separate and see the difference between 2 letter N's and the letter M. So they go out and register these domains, and it only costs $12.95. But the other thing we know is that most of the time, once they register the domain has only been in existence less than 72 hours, because it usually doesn't take long before somebody catches up with them and finds it's not legitimate. And also many times they pay for their domain registration with a fake credit card. So that's one of the ways they get those things set up. But they're always looking to try and fake you out by using something like that. They sometimes try to personalize the email, putting something in there to make you think or convince you that this is the real person. They do their homework. They go out to the websites of hospitals and healthcare systems. They look for the leadership, so they find out who's the CFO, who's the CEO, who's the COO. They go to LinkedIn, they find information about those individuals, and then craft their message. If you get a message that's asking you for a lot of personal information or stuff that just doesn't seem right, that should be your red flag there, that it's not a real email, that it is actually a phishing email. If they ever ask you to send money to cover the cost, yeah, that's probably not it. If it's trying to be official, like it's coming from the government. I had a director at one of the hospitals I was working with forward an email that said, is this legitimate? And I looked at it, and it had a link in there, and it said, you're being audited by the IRS. Click on this link. Well, first of all, it didn't have this person's name on the email. It just said, you are being audited. And when you hover over the link that they put in the email, you could actually see at the bottom of the screen the real URL. And when I looked at the last 2 characters, which represents the country code, it was the Cayman Islands. Now, as far as I know, the IRS has not opened any operations in the Cayman Islands. So there's my clue that this is a fake one. The one thing that also gets me is if it's something that doesn't sound right. And I want to give you 2 examples that were shared with me from other organizations that had some phishing emails. The first one I thought was real interesting is their executive, their CEO, and just for fun, we're going to say his name was Jim. The chief financial officer gets an email from the CEO, Jim, asking him to transfer money. The thing is, when the email started, it said, hi, how are you? Well, the CFO knew it was fake because their executive, Jim, never starts an email with, hi, how are you? In another example, someone reported that the comptroller was asking for money to be transferred. And when they looked at the bottom of the email, it said, sent from my iPhone. Well, anybody who knew, the comptroller knew that they did not have an iPhone. They had a Samsung Galaxy, and they let everybody know they had a Samsung Galaxy. So that was an easy one to pick up on. So we have to look for these little clues that tell us it's a phishing email. And we have to educate our workforce on this. Now, there are lots of business challenges in the cyber world that are kind of unique to healthcare. And this next slide lists some of the areas that concern me because by law, in many cases, or just for the way we do business, we've got to share patient information outside of the healthcare organizations. So for example, our patients are now by law able to get access to their medical records through a patient portal, which is a website that they can go to so they can find out things like test results and make appointments. We have other providers. There's emails, there's text messaging. We have clearinghouses and insurance companies where we have to share this information. In the part 1 of this series, I talked about business associates and some of the risk associated with that. And of course, there's government entities. So we have patient information that's in a healthcare organization, but it doesn't stay there. It has to go to all these other places as well. The internet in itself poses risk. Hospitals are becoming more and more dependent on the internet than ever before. And the FBI has observed that there's been a lot of activity, in particular to the healthcare industry. And it's nothing new, it's just that what happens is the cyber attackers are always looking for where can they get the most valuable data with the least amount of work. So they started initially with all the financial institutions, and as they hardened their systems, it became more of a challenge to get the data. So now they're moving to other targets, and healthcare seems to be in their crosshairs. Every corporate entity today, government, private, we get a lot of notices from security organizations about new breaches, new vulnerabilities, new security patching that we're supposed to put in place. There's a lot to keep up with. And keep in mind, the hackers, they only have to get it right once. We got to get it right every day, 7 days a week. So it's really tough to keep up with that. The other things we look at is the cyber attacks are growing more sophisticated. I mentioned in part 1 that we've moved away from just the sole individual who's a hacker who sits in their parents' basement to nation states as well as organized crime. So their level of attacks are much more sophisticated than ever before. And no matter what we do, security is not 100%. We do the best possible job we can. And our goal here then is to try to discourage those by putting enough levels of security in place to make it more challenging and more difficult so they move on to a softer target. Now here's an interesting statistic that I think you should know. On average, a hacker is in an organization's computer systems for 204 days before they're detected. 204 days. That's 3/4 of a year. So that's a long time to be in your systems collecting data. Therefore, we find that these breaches are getting larger in the volume of patients and data being extracted, and it's taking longer to investigate, and it's a lot more challenging. Consequently, because of the rise in all these cyber attacks and breaches, what we're finding is cyber insurance policies are going up as far as their premiums, and what's excluded as far as what's being covered is also on the rise. So it's really hard to even get insurance now to protect against cyber attacks. You may have heard the term Internet of Things, or IoT. What does that mean? Well, basically it means anything that connects via the internet. And we have a lot of things that connect the internet these days. And if it does, it's a potential target for anybody out there. We used to have in buildings for unique proprietary control systems for things like air handlers and water chillers, and not anymore. These are running Windows-based computers, and they're remote access so that the companies that service that equipment can come in remotely to control it. If it connects to the internet, it's a target. Those devices are what we call SCADA, which means it's a supervisory control and data acquisition device. You may have also heard the term SMAC, which stands for Social Mobile Analytics and Cloud. All of those represent great risk to us in healthcare. You may have seen the recent news story about some hackers who successfully hacked into a Jeep Cherokee. It was on NBC News, and they showed how they were able to take control away from the driver. They were able to do simple things like operate the windshield wipers, honk the horns, lock the doors, and then they were also able to do things that were a little more destructive. They were able to shut off the engine or start the engine. So these are concerns because you just don't think about hackers hacking into your car. That's just something that's not always top of mind. The FBI has issued several notifications regarding biomedical devices and that they're now a target for attacks as well. There's been some demonstrations as far as what an individual could do if they're able to hack into things like an insulin pump, for example, and change the dosage. Through my many years of experience in conducting risk analysis at various hospitals and healthcare systems, I've come up with a list of what I think are some of the common findings with biomedical devices as far as their inherent weaknesses. And it's kind of alarming when you see this because these are things that are repeated hundreds and thousands of times in each hospital all over the country. Most of these biomedical devices have an administrator account for working on for the biomed technicians, and generally that is a generic account. If you're a biomed tech and you work on a particular piece of equipment in one hospital and you go to another hospital and they have that same equipment, chances are you know how to get into it. We don't have antivirus software loaded on these, nor do we have any other endpoint security, such as intrusion prevention system or intrusion detection system, what we call IPS or IDS. These can be remotely controlled. They can be accessed by the vendor. So if the vendor can get into it remotely, so can a cyber attacker. And many of these devices are wireless and they're running weak wireless encryption. Some of them are still running what's called WEP, which is wired equivalent privacy, and it's not the standard today for wireless encryption. Because it takes so long to get a device through the FDA approval, we find that many times once a biomedical device hits the market, it's already running outdated software and operating system as far as compared to other computers. The next thing we have to deal with is our smartphones, because smartphones are playing more of a role in mobile healthcare and telehealthcare. But mobile devices are very vulnerable to hackers and attacks. Mainly the way folks get through it is through your apps. Now this slide here, what I want to point out to you is I just did a Google search and I put in there, in quote marks, hacking smartphones. These were 4 of the top hits that came up. They're basic instructions telling anybody how to go and hack a smartphone. Some of them include videos along with the instructions on how to do it. It's very alarming to me. In security, in healthcare, this slide represents what I feel and I know from my experience are the top concerns of executives as well as security professionals. We're finding these targeted attacks. I mentioned phishing, but we also have spear phishing, where they go and get detailed information about our executives and try to use that against us to trick people. We have our insiders who are still snooping or maybe responsible for identity theft. It's hard to stop them because they are the authorized user. They're just misusing their privileges. We have our business associates who may not do a good job of securing the patient data that they have. Malicious code in the form of ransomware or phishing. Mobile apps. Biomedical devices. This is a concern because, again, it can impact patient lives, not just data. Now, I don't know of any incidents today where someone actually hacked into a biomedical device and caused harm. But it's not to say it's not on the future horizon here. And mobile devices, if you're going to allow people to bring in a mobile device, their own personal mobile device, you really need mobile device management if they're going to use that personal device to do work. Mobile device management, I'll explain in part 3, goes into controlling the phone and protecting the data better than we can just to rely on our employees to do it. The last one on my list here is webmail. With the advent, again, of mobile devices and mobile device management, I think we no longer need webmail in the business environment in healthcare. What people don't understand is webmail makes mail available anywhere, anytime, on any device, as long as it's connected to the internet. If you ever get an email with an attachment, and you click on that attachment and open it, where is it stored? It's stored in a temp file on that device. So that means if someone sends an email with patient information in, let's say, a spreadsheet or a Word document, and I open it up and look at it, it's stored on whatever machine device I use to get that. Now, the question is, do you know that your PHI has now been stored somewhere outside of your organization where you have absolutely no control over it? So I think webmail had served its purpose way back, but I think it's time to end it. So, in summary, session 2 of this 3-part series, we talked about doing business in the cyber world and some of the many challenges that we face. We talked about the Internet of Things and how it increases the likelihood of our breaches. So what are we going to do with all this? Well, in part 3, we'll talk about some of the cybersecurity plans we can put in place, meaning safeguards and controls, and how to prepare ourselves to address a board of trustees or board of directors and letting them know what we're doing to protect the data. Thank you very much. Appreciate you attending, and I appreciate those of you watching this video. Thank you.